Anatomical position. So answer, anatomical positions are: point number A, body should be erect in a standing position.
नमस्ते, म रूपेश चौधरी। यो लकडाउनको कारणले धेरैले नोट नसारेको साथीले भन्दै थियो, त्यसैले यो भिडियो सुट गरेको हो। यो सिटिभिटी फर्स्ट इयरको जे जति एनाटोमीमा आउने हुन्छ, फाइनल एक्जाममा आउने हुन्छ त्यो क्वेसनहरू, त्यो सबै मैले यसमा आउट गरेको छु। सो अन्तसम्म भिडियो हेर्नु होला। यदि नयाँ हुनुहुन्छ भने प्लिज लाइक, कमेन्ट एन्ड सब्सक्राइब दिस च्यानल। म रूपेश चौधरी। थ्याङ्क यू, बाय बाय।
Anatomical position. So answer, anatomical positions are: point number A, body should be erect in a standing position. Body should be erect in a standing position. Point number B, I should look straight to the front. I should look straight to the front. Point number C, upper limb hang by the side of trunk with palm directed forward and finger directed downward. Upper limb hang by the side of trunk with palm directed forward and finger directed downward. Point number D, lower limb should be parallel with twice pointing forward. Lower limb should be parallel with twice pointing forward. Example: supine position, prone position, lateral position, lithotomic position, Sims position and dorsal recumbent position. According to the shape and size of the bone found in human body. With example, so the shape and size are found in human body are: short bone, long bone, flat bone, sesamoid bone, pneumatic bone, irregular bone, accessory bone. So point number A, short bone, cuboid, carpal and tarsal bone. Cuboid, carpal and tarsal bone. Point number B, long bone, femur, fibula, radius and tibia bone. Femur, fibula, radius and tibia bone. Point number C, flat bone, cranium, scapula and ribs bone. Cranium, scapula and ribs bone. Point number D, sesamoid bone. Sesamoid bone, patella, pacciform. Patella and pacciform bone. Point number E, pneumatic bone. Example: maxilla, ethmoid, sphenoid. Maxilla, ethmoid, sphenoid. Point number F, irregular bone. Irregular bone. Example: hip bone and bone of the face. Hip bone and bone of the face. Point number G, accessory bone. Accessory bone. Example: os trigonum. Os trigonum. Define flexion and extension. Define flexion and extension. So flexion, the movement by which angle of joint is decreased is known as flexion. The movement by which angle of joint is decreased is known as flexion. Extension, extension, the movement by which angle of joint is increased is known as extension. The movement by which angle of joint is increased is known as extension. Define anatomy and physiology. Define anatomy and physiology. So anatomy, it is the branch of medical science which deal with the study of structure of human body. It is the branch of medical science which deal with the study of structure of human body. Physiology. Physiology, it is the branch of medical science which deal about the function of different body organ. It is the branch of medical science which deal about the function of different body organ. Define ossification. Define ossification. So the formation of bone from the embryological component is called ossification. The formation of bone from the embryological component is called ossification. It types of ossification. Types of ossification. Point number A, intramembranous ossification. Intracartilaginous ossification. Draw a well level diagram of eye. यो क्वेसन मोस्ट रिपिटेड क्वेसन हो, किनकि यो धेरैपल्ट एक्जामिनेसनमा आइसकेको छ र गर्नुपर्ने यति मात्रै हो, यो चित्र बनाउने र चित्रको यो नामहरू दिने हो। सो यति गर्यो भने एटलिस्ट 4 मार्क्स आउँछ, त्यही भएर मैले यो क्वेसन हालेको हो यसमा। सो यो क्वेसन मजाले गर्नु, एकपल्ट भएन भने 2-3 पल्ट गर क्या, तर गर्नलाई गर, किनकि एटलिस्ट 4 मार्क्स आउँछ। 4 मार्क्स भनेको कम होइन। सो छोड्नु हुँदैन, ड्रो बनाउनु र यसको नाम दिनु। सो ड्रो अ वेल लेभल डायग्राम अफ आई. सो चैम्बर, पोस्टेरियर चैम्बर, स्लाइरे बॉडी, कोर्निया, इरिस, पुपिल, इंटीरियर चैम्बर, कैनल स्टिलिमा, conjunctiva, anterior segment, posterior segment or optics fundus, optics disc or blind spot, optics nerve, fovea centralis, macula latea, sclera, choroid, retina, lateral rectus muscle, lateral rectus muscle. Name the tissue layer present in the wall of eye. Name the tissue layer present in the wall of eye. Point number A, outer fibrous layer. Point number B, middle vascular layer. Point number C, inner nervous tissue layer. So, outer fibrous layer, sclera cornea. Middle vascular layer, choroid, ciliary body or iris. Point number 3, inner nervous tissue layer, retina. Write the organ of male and female reproductive system. Write the organ of male and female reproductive system. So male reproductive system, penis, testes, prostate gland, seminal vesicle, spermatic cord, vas deferens, epididymic, ejaculatory duct. So male reproductive system, penis 1, testes 2, prostate gland 1, seminal vesicle 2, spermatic cord 2, vas deferens 2, epididymic 2, ejaculatory duct 2. So penis 1, testes 2, prostate gland 1, seminal vesicle 2, spermatic cord 2, vas deferens 2, epididymic 2, ejaculatory duct 2. Female reproductive system, vagina, ovaries, uterus, vulva, fallopian tube. Vagina, ovaries, uterus, vulva, fallopian tube. Name the lungs covering layer. Name the lungs covering layer. The lung covering layer is pleura. The lungs covering layer is pleura. Name the heart covering layer. Name the heart covering layer. The heart covering layer is pericardium. The heart covering layer is pericardium. Pericardium. What is sarcomere? What is sarcomere? A structural unit of myofibril in a straight muscle consists dark and light bond. What is sarcomere? What is sarcomere? A structural unit of myofibril in a straight muscle consists dark and light bond. What is sarcomere? A structural unit of myofibril in a straight muscle consists dark and light bond. What is sarcomere? A structural unit of myofibril in a straight muscle consists of dark and light bond. A structural unit of myofibril in a straight muscle consists of dark and light bond. Define sesamoid bone. Define sesamoid bone. Sesamoid bone are bony noodle found embedded in the tendon or joint capsule. Define sesamoid bone. Define sesamoid bone. Sesamoid bone are bony noodles found embedded in the tendon or joint capsule. Example, patella peciform. Define sesamoid bone. The sesamoid bone are bony noodle found embedded in the tendon and joint capsule. Example, patella or peciform bone. What is bone? What is bone and its types? So bone, what is bone? Bone is a rigid form of connective tissue that forms most of the skeleton and its chief supporting tissue of the body. What is bone? Bone is a rigid form of the connective tissue that forms most of the skeleton and its chief supporting tissue of the body. And its types. Point number A, calcareous bone or spongy bone. Point number B, compact bone, dense bone. Calcareous bone, spongy bone, compact bone, dense bone. So, function of bone. Function of bone. Point number A, they contain bone marrow which manufacture blood cell. They contain bone marrow which manufacture blood cell. Point number B, they mediate weight transmission. They mediate weight transmission. Point number C, bone store 97% of the body calcium and phosphate. Bone store 97% of the body calcium and phosphate. Point number 4. They serve as a lever for muscular action. They serve as lever for muscular action. Point number 5. They provide surface for the attachment of muscular tendon, ligament, etc. They provide surface for the attachment of muscles, tendon, ligament, etc. Point number 6. Bone gives shape and support to the body. Bone gives shape and support to the body and resist all form of stretch. Bone gives shape and support to the body and resist all form of stretch.
आशा छ मलाई यो भिडियो तपाईहरूलाई हेल्पफुल हुन्छ भनेर, त्यही भएर बनाएको हो। प्लिज इन्डसम्म हेर्नु होला, किनकि कुनै क्वेसन पनि नछोड्नु इक्जाममा जानुभन्दा पहिला।
Explain about skin in detail. Explain about skin in detail. So answer. The skin has a surface area about 1.5 to 2 meter square in normal adult, 0.5 to 3 mm thick. The skin has a surface area about 1.5 to 2 meter square in normal adult, 0.5 to 3 mm thick. So point number 2. 5 skin is the largest organ that cover entire outer surface of the body for protective layer, barrier agent, microorganism and injury from the environment. 5 skin is the largest organ that cover entire outer surface of the body for protective layer, barrier agent, microorganism and injury from the environment. Point number C. The color of the skin is determined by melamine, melanoid, keratin, hemoglobin and oxyhemoglobin. The color of the skin is determined by melamine, melanoid, keratin, hemoglobin and oxyhemoglobin. The skin is mainly composed of two layers. The skin is mainly composed of two layers, that is epidermic and dermic layer. That is epidermic and dermic layer. So point number A, epidermic. So the epidermic is the uppermost avascular layer. The epidermic is the uppermost avascular layer. It is composed of stratified squamous epithelium. It is composed of stratified squamous epithelium. Its thickness varies in different part of the body. Its thickness varies in different part of the body. It is thickest on the palm of the hand and sole of the feet. It is thickest on the palm of the hand and sole of the feet. So epidermic consists of following layer of cell. The epidermic consists of following layer of a cell, that is stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, stratum germinativum or basal. Stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, stratum germinativum or basals. So point number next. The superficial layer consists of death cell. The superficial layer consists of death cell. Point number next. The nucleus and protoplasm of the cell are charged into a hard mass known as keratin. The nucleus and protoplasm of the cell are changed into a hand mass known as keratin. The cell of the deeper layer are living round in structure and content of nucleus. The cell of deeper layer are living round in a structure and contain a nucleus. Point number next. The cell of deeper layer proliferate and pass toward the surface. The cell of deeper layer proliferate and pass toward the surface. The cell of the deeper layer proliferate and pass toward the surface. Point number next and last. Melamine is secreted by melanocytes present in deep germinativum layer. Melanin is secreted by melanocytes present in deeper germinativum layer. Melanin is secreted by melanocytes present in deeper germinativum layer. Melanin is secreted by melanocytes present in deeper germinativum layer. Dermic. Point number B, dermic. Point number B, dermic. So it is the inner deeper vascular layer of the skin. It is inner deeper vascular layer of the skin. So point number next. It is mode of connective tissue and elastic tissue. It is mode of connective tissue and elastic tissue. Point number next. The dermic contain more fat than epidermic. The dermic contain more fat than epidermic. Point number next. The structure present in the dermic are that is blood vessel, lymph vessel, sensory vessel, sweat gland, sebaceous gland, hair root, hair follicle and hair. Blood vessel, lymph vessel, sensory vessel, sweat gland, sebaceous gland, hair root, hair follicle and hair. So, function of epidermic skin सोध्यो भने यो तीनवटा सार दिनु. फंक्शन अफ एपिडर्मिक स्किन सोध्यो भने यो तीनवटा सार दिनु र फंक्शन अफ डर्मिक स्किन सोध्यो भने यहाँदेखि यहाँसम्म सार दिनु. फंक्शन अफ डर्मिक स्किन सोध्यो भने यहाँदेखि यहाँसम्म सार दिनु. सो यदि फंक्शन अफ स्किन मात्रै सोध्यो भने यो सबै सार्दा हुन्छ किनकि एपिडर्मिक र डर्मिक त्यसैको लेयर हो. सो point number 1. It protect body from environment, especially sunlight. It protect body from environment, especially sunlight. Point number next. It prevent excess of water loss. It prevent excess of water loss. It prevent or protect skin from the infection of dermic. It prevent or protect skin from infection of dermic. It provides sensation which give awareness of environment. It provides sensation which give awareness of environment. Point number next. It regulate the body temperature. It regulate the body temperature. It excretes salt like chloride and metal like urea. It excretes salt like chloride, metal like urea. It excretes salt like chloride and metal like urea. It stores fat, water, chloride and sugar. It stores fat, water, chloride and sugar. It stimulates sensation of touch, pain, pressure and temperature. It stimulates sensation of touch, pain, pressure and temperature. Point number next. It synthesizes vitamin D3 by action of ultraviolet ray on the cholesterol. It synthesizes vitamin D3 by action of ultraviolet ray on the cholesterol. Point number next. It regulates water balance and electrolyte balance. It regulates water balance and electrolyte balance. Point number last. It secretes sweat and sebum. It secretes sweat and sebum. So, division of skeleton system. Division of skeleton system. So, point number A, axial skeleton. So axial skeleton मा 87 एउटा बोन हुन्छ जसमध्ये 7 एउटा माइनस हुन्छ किनकि हाइड बोन र एडियोटरी ओसिकल बोन गनिदैन. हाइड बोन एउटा हुन्छ र एडियोटरी ओसिकल 6 एउटा हुन्छ जसमा 7 एउटा टोटली हुन्छ र 7 एउटा माइनस गरिएको छ किनकि यो गनिदैन. सो स्क्युल बोनमा क्रेनियम अनि फेस हुन्छ. क्रेनियममा 8 एउटा बोन हुन्छ, फेसमा 14 एउटा हुन्छ. सो दुईटै जोडेर 22 हुन्छ. सो स्क्युलमा 24 एउटा बोन हुन्छ र क्रेनियममा 8 एउटा बोन हुन्छ र फेसमा 14 एउटा बोन हुन्छ. सो भेर्टिब्रल कोलम 33 बोन हुन्छ. थायरेक्स बोन 25 एउटा बोन हुन्छ र थायरेक्समा पर्ने भनेको स्टर्नियम एउटा हुन्छ र रिब्स 24 एउटा हुन्छ. सो axial skeleton 80 bone, skull 24 bone, cranium 8 bone, face 14 bone, vertebral column 33 bone, thorax 25 bone, sternum 1 bone, ribs 24 bone, head bone and auditory ossicles are not included. Appendicular skeleton. It has 126 bone. So shoulder guideless मा 4 एउटा बोन हुन्छ जसमध्ये क्लेविकल र स्क्यापुला हुन्छ. सो क्लेविकल बोन 2 बोन, स्क्यापुला 2 बोन. सो अपर लिम्ब और अपर एक्स्ट्रिमिटीज. सो अपर लिम्ब मा 60 एउटा बोन हुन्छ. सो ह्युमरस 2 बोन, अल्ना 2 बोन, रेडियस 2 बोन, कार्पल 16 बोन, मेटाकार्पल 10 बोन, phalanx 28 bones. So pelvic guideless मा 2 वटा बोन हुन्छ जसमा हिप बोन भनिन्छ. हिप बोन 2 बोन, हिप बोन्स 2 बोन्स. सो लोयर लिम्ब और लोयर एक्स्ट्रिमिटीज मा 60 वटा बोन हुन्छ. अपर लिम्ब र लोयर लिम्ब मा 60 वटा बोन हुन्छ. सो लोयर लिम्ब. सो फेमर 2 बोन, patella 2 bone, tibia 2 bone, fibula 2 bone, tarsal 14 bone, metatarsal 10 bone, phalanx 28 bones. सो अघि भनेको थिए नि स्कुलमा कतिवटा बोन हुन्छ 22 वटा. सो क्रेनियम र फेस मिलाएर 22 वटा हुन्छ किनकि 8 र 14 8 गर्दाखेरि 22 बोन हुन्छ. सो क्रेनियम बोन 8. सो फ्रन्टल, पेरेन्टियल, टेम्पोरल, ओसिपिटल, स्पिनोइड, इथमोइड. सो क्रेनियम बोन फ्रन्टल 1 बोन, पेरेन्टियल 2 बोन, टेम्पोरल 2 बोन, ओसिपिटल 1 bone, sphenoid 1 bone, ethmoid 1 bone. सो फेसमा भएको बोनहरू. सो फेस 14 बोन. सो फेसमा भएका बोनहरू जाइगोमेटिक और चिक बोन 2 बोन, मैक्जिला 1 बोन, नजल 2 बोन, लेक्रिमल 2 बोन, मेन्डिबल 1 बोन, इन्फेरियर 2 बोन, भोमर 1 बोन, प्लेटाइन 2 bone. So lower limb of joint. So hip joint, knee joint, ankle joint. Hip joint, knee joint, ankle joint. So upper limb of joint. So shoulder joint, elbow joint, rib joint. Shoulder joint, elbow joint, rib joint. Wrist joint, carpometacarpal joint, metacarpophalangeal joint. Wrist joint, carpometacarpal joint, metacarpophalangeal joint. What is joint? It types. Joint is the junction between two or more bone or cartilage. Joint is the junction between two or more bone or cartilage. There are more joints in a child than in adult because as the growth proceeds, some bones are fused together. The study of bone is called arthrology. So it is divided into 3 types. So point number A, fibrous joint. Point number B, cartilaginous joint. Point number C, synovial joint. So यसमध्ये synovial joint धेरै सोधिने गरेको छ. So explain गरेको छु synovial joint को. So define synovial joint or explain synovial joint. This joint allow considerable free movement. So in this joint, bone are united by cartilage with synovial membrane enclosing the joint cavity. In this joint, bone are united by cartilage with synovial membrane enclosing the joint cavity. So its possible movement are flexion, extension, abduction, rotation. So flexion, bending usually forward but occasionally backward. Extension, straightening or bending backward. Adduction, the movement toward the midline of the body. Abduction, the movement away from the midline of the body. Rotation, the movement round the axis of the bone. So types of synovial joint with example. So point number A, ball and socket joint. Example, shoulder and hip joint. So point number B, hinge joint. Example, elbow knee interphalangeal joint. Point number C, candyloid joint. Example, wrist jaw joint. Point number D, pivot joint. Example, atlantoaxial joint. Point number E, sliding joint. Example, intervertebral joint. So point number F, saddle joint. Example, sternoclavicular joint. Difference between endocrine gland and exocrine gland. So endocrine gland, these are the ductless gland. They release their secretion directly into the blood. Their secretion are known as hormones. Example, pituitary gland, thyroid gland, adrenal gland. So exocrine gland. These are the gland with duct. They release their secretion into the epithelial surface of any organ. They release their secretion into the epithelial surface of the organ. Enzyme is one of the main components of their secretion, for example, sweat gland, sebaceous gland, and gastric gland. Enzyme is one of the main components of their secretion, for example, sweat gland, sebaceous gland, and gastric gland. So mixed gland. These are the glands having both endocrine as well as exocrine function. That is, they can secrete hormones as well as enzymes. For example, pancreas. Mixed gland. These are the glands having both endocrine as well as exocrine function. That is, they can secrete hormones as well as enzymes. For example, pancreas. What is neuron? What is neuron and its types? What is neuron? Neuron is the structural and functional unit of nervous system. Is called neuron. Neuron is the structural and functional unit of nervous system. Is called neuron. Types of neuron are point number A on the basis of pole, point number B on the basis of function, point number C on the basis of length of axon. So point number A on the basis of pole. So unipolar neuron, bipolar neuron, multipolar neuron, pseudopolar neuron. Point number A on the basis of pole. Unipolar neuron, bipolar neuron, multipolar neuron, pseudopolar neuron. So point number B on the basis of function. On the basis of function. So sensory neuron, motor neuron, and mixed neuron. So point number C on the basis of length of axon. On the basis of length of axon. So Golgi type first, Golgi type second. Golgi type first, Golgi type second. So each different part of neuron. So point number A, cell body, axon, dendrite. Cell body, axon, dendrite. So difference between straightened muscle, smooth muscle, and cardiac muscle. Difference between straightened muscle, smooth muscle, cardiac muscle. So straightened muscle, it is attached with skeleton. It is attached with skeleton. It is voluntary in nature. It is voluntary in nature. It get fatty juice easily. It get fatty juice easily. It is cylindrical shape. It is cylindrical shape. Its nucleus is multiple are present. Its nucleus is multiple are present. So last point. Intercalated disc is absent. Intercalated disc is absent. So smooth muscle, it is present in internal organ. It is present in internal organ. So it is involuntary in nature. It is involuntary in nature. It doesn't get fatty juice. It doesn't get fatty juice. It is a spiral shape. It is a spiral shape. Its nucleus is single are present. Its nucleus is single are present. Intercalated disc is absent. Intercalated disc is absent. So cardiac muscle. Cardiac muscle. It is present in myocardium of heart. It is present in myocardium of heart. So it is involuntary in nature. It is involuntary in nature. It never get fatty juice. It never get fatty juice. It is branch. It is branch. So its nucleus is single are present. Its nucleus is single are present. Intercalated disc is present. Intercalated disc is present. So difference between straightened muscle, smooth muscle, cardiac muscle. So point number 1. It is attached with skeleton. It is attached with skeleton. It is present in internal organ. It is present in internal organ. It is present in myocardium of heart. It is present in myocardium of heart. So point number 2. It is voluntary in nature. It is voluntary in nature. It is involuntary in nature. It is involuntary in nature. It is involuntary in nature. So point number 3. It get fatty juice easily. It get fatty juice easily. So it doesn't get fatty juice. It doesn't get fatty juice. It never get fatty juice. It never get fatty juice. Point number 4. It is cylindrical shape. It is cylindrical shape. It is a spiral shape. It is a spiral shape. It is branch. It is branch. Point number 5. The it nucleus is multiple are present. It nucleus is multiple are present. It nucleus is single 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 are present. Point number 6. Intercalated disc is absent. Intercalated disc is absent. Intercalated disc is absent. Intercalated disc is absent. Intercalated disc is present. Intercalated disc is present. So, difference between a striated muscle, smooth muscle and cardiac muscle are: describe cardiac cycle. Describe cardiac cycle. So, cardiac cycle mean one complete heartbeat. Cardiac cycle mean one complete heartbeat. It consists of both systole and diastole. It consists of both systole and diastole. So, the period of contraction is called systole. The period of contraction is called systole, and the period of relaxation is called diastole. The period of relaxation is called diastole. So, the normal number of cardiac cycle per minute range from 60 to 80. The normal number of cardiac cycle per minute range from 60 to 80. Each cardiac cycle lasts for about 0.8 seconds. Each cardiac cycle lasts for about 0.8 seconds. So, the cardiac cycle consists of following 3 stages. The cardiac cycle consists of 3 stages. That is, so stages of cardiac cycle are: point number A, atrial systole 0.1 second. Point number B, ventricular systole 0.3 second. Point number C, complete cardiac diastole 0.4 second. So, atrial systole. So, describe their each stage. Describe their each stage. So, atrial systole. Atrial systole. Point number A, atrial systole. It means contraction of atria. It means contraction of atria. It lasts for about 0.1 second. It lasts for about 0.1 second. The superior vena cava and inferior vena cava and coronary sinus transport deoxygenated blood to the right atrium of the heart. The superior vena cava and inferior vena cava and coronary sinus transport deoxygenated blood to the right atrium of the heart. At the same time, for pulmonary vein pass oxygenated blood to the left atrium. At the same time, for pulmonary vein pass oxygenated blood to the left atrium. At the same time, for pulmonary vein pass oxygenated blood to the left atrium. The SA node triggers a wave of contraction that quickly spread over the myocardium of the both atria. The SA node triggers a wave of contraction that quickly spread over the myocardium of both atria. This results in the contraction of atria and opening of atrioventricular valve. This results in the contraction of atria and opening of atrioventricular valve. The blood flow in the ventricle. The blood flow in the into the ventricle, and there is impeding of atria. The blood flow into the ventricle, and there is impeding of the atria. The blood flow into the ventricle, and there is impeding of the atria. Point number B. Point number B, ventricular systole. Point number B, ventricular systole. It means contraction of ventricle. It means contraction of ventricle. So, it lasts for about 0.3 seconds. It lasts for about 0.3 seconds. When the atria contract, the wave of contraction reaches the AV node. When the atria contract, the wave of contraction reaches the AV node. When the atria contract, the wave of contraction reaches the AV node. The AV node is stimulated to produce an impulse. The AV node is stimulated to produce any impulse. This impulse quickly spread over the AV bundle, branch and Purkinje fiber. This impulse quickly spread over to the AV bundle, branch and Purkinje fiber. This impulse quickly spread over to the AV bundle branches and Purkinje fiber. This results in the contraction of ventricle and opening of aorta and pulmonary valve. This result in the contraction of ventricle and opening of aortic and pulmonary valve. The blood flow into systemic and pulmonary circulation, and there is emptying of the ventricles. The blood flow into systemic and pulmonary circulation, and there is emptying of the ventricle. So, figure of cardiac cycle. So, figure of cardiac cycle. 0.1 second auricular systole, मतलब auricular systole 0.1 second, ventricular systole 0.3 second, complete cardiac diastole 0.4 second. Figure of cardiac cycle. Point number C, complete cardiac diastole. Point number C, complete cardiac diastole. So, point number A, it lasts for about 0.4 second. It lasts for about 0.4 second. After the contraction of the ventricle, there is complete cardiac diastole. That is, the atria and ventricle are relaxed. After the contraction of the ventricle, there is complete cardiac diastole. That is, the atria and ventricle are relaxed. During this time, the myocardium recovers until it is able to contract again and the atria refill in preparation for next cycle. During this time, the myocardium recovers until it is able to contract again and the atria refill in preparation for next cycle. What is G of R? And full form of G of R is glomerular filtration rate. So, what is G of R? The volume of fluid formed by both kidney per minute is called G of R. The volume of fluid formed by both kidney per minute is called G of R. Full form of G of R is glomerular filtration rate. Glomerular filtration rate. So the organ of urinary system are two kidney, two ureter, one urinary bladder, one urethra. Two kidney, two ureter, one urinary bladder, one urethra. Composition of urine. So point number A, water 96%, urea 2%, other 2%. So water 96%, urea 2%, other 2%. Other 2%. So uric acid, sodium chloride, creatine, potassium sulfate, phosphate, oxalate, hormones, HCG. Uric acid, sodium chloride, creatine, potassium sulfate, phosphate, oxalate, hormones, HCG. So vitamins, water soluble vitamin and vitamin D. Vitamins, water soluble vitamin and vitamin D. Write short note on reflex ARC. So pathway travel by any impulse during reflection is called reflex ARC. Write short note on reflex ARC. So pathway travel by any impulse during reflection is called reflex ARC. So this is the figure of reflex ARC. So another answer is reflex ARC. This is the another answer of reflex ARC. So the basic unit of integrated reflex activity is called reflex ARC. The basic unit of integrated reflex activity is called reflex ARC. This is the another answer of reflex ARC. Pathway of reflex ARC. Pathway of reflex ARC. So receptor ending of afferent fiber. So it receive impulse. So next, afferent neuron from receptor to CNS. It carries impulse from receptor to CNS. So next, internal neuron inside CNS. Interneuron inside CNS. It interpret receive impulse. It interpret receive impulse. So synapse, contact between two neuron. It contact between two neuron. So next, efferent neuron from CNS to efferent neuron. Efferent neuron from CNS to effector organ. Efferent neuron from CNS to effector organ. It carries command from CNS to effector organ. Describe the menstrual cycle. Describe the menstrual cycle. So it is also regarded as sexual cycle. It is also regarded as sexual cycle. It is normal physiological process that occur in female from puberty throughout the childbearing period, approx 36 years. It is normal physiological process that occur in female from puberty throughout the childbearing period, approx 36 years. So the average length of menstrual cycle is about 28 days. The average length of menstrual cycle is about 28 days. The menstrual cycle consists of series of changes that take place in the ovary and uterus. The menstrual cycle consists of series of changes that take place in the ovary and uterus. The menstrual cycle is normally described in three phases. The menstrual cycle is normally described in three phases, that is, menstrual phases is 3 to 5 days, menstrual phase 3 to 5 days, proliferative phase 10 days, secretory phase 14 days. So point number A, menstrual phase 3 to 5 days. Point number B, proliferative phase 10 days. Point number C, secretory phase 14 days. So explain about menstruation, menstrual phases. Explain about menstrual phases. Point number A, menstrual phases. So this phase is characterized by vaginal bleeding. This phase is characterized by vaginal bleeding. It is last for about 3 to 5 days. It lasts for about 3 to 5 days. The bleeding occurs when the ovum is not fertilized. The bleeding occurs when the ovum is not fertilized. The bleeding occurs when the ovum is not fertilized. At this stage, the production of LH from interior pituitary gland is reduced. At this stage, the production of LH from the anterior pituitary gland is reduced. The reduction of these hormones causes degeneration of corpus luteum. The reduction of these hormones causes degeneration of corpus luteum. Due to degeneration of corpus luteum, the production of progesterone is reduced. About 14 days after ovulation, the lining of uterus degenerate and menstruation begin. About 14 days after ovulation, the lining of uterus degenerate and menstruation begin. The menstrual flow consists of secretion from endometrium gland, endometrium cell, blood from the broken down capillaries and the unfertilized ovum. The menstrual flow consists of secretion from endometrium gland, endometrium cell, blood from the broken down capillaries and the unfertilized ovum. The normal amount of blood flow and each cycle is about 60 to 90 ml. The normal amount of blood flow and each cycle is about 60 to 90 ml. The normal amount of blood flow and each cycle is about 60 to 90 ml. The normal amount of blood flow and each cycle is about 60 to 90 ml. Point number B. Point number B, proliferative phase. Point number B, proliferative phase. So this phase lasts for about 10 days. This phase lasts for about 10 days. It starts after menstruation and lasts till the occurrence of ovulation. It starts after menstruation and lasts till the occurrence of ovulation. During this phase, the ovarian follicle starts maturing under the influence of FSH from the interior pituitary gland. During this phase, the ovarian follicle starts maturing under the influence of FSH from the interior pituitary gland. The mature ovarian follicle, Graafian follicle, produce the hormones estrogen. By the end of this phase, the endometrium become 2 to 3 mm thick. By the end of this phase, the endometrium become 2 to 3 mm thick. By the end of this phase, the endometrium become 2 to 3 mm thick. By the end of this phase, the endometrium become 2 to 3 mm thick. When ovum is mature, the follicle rupture and ovum come out into the peritoneal cavity. When ovum is mature, the follicle rupture and ovum come out into the peritoneal cavity. Peritoneal cavity. When the ovum is mature, the follicle rupture and ovum come out into the peritoneal cavity. When the ovum is mature, the follicle rupture and ovum come out into the peritoneal cavity. When the ovum is mature, the follicle rupture and ovum come out into the peritoneal cavity. The release of ovum from follicle is known as ovulation. The release of ovum from follicle is known as ovulation. This phase ends when ovulation occurs. So point number C, secretory phase. So this phase starts after the occurrence of ovulation and lasts for about 14 days. LH Sergi case ovulation. After ovulation, the lining cell of the ovarian follicle are stimulated by LH to develop corpus luteum. After ovulation, the lining cell of the ovarian follicle are stimulated by LH to develop corpus luteum. The developed corpus luteum produce progesterone. Progesterone helps the action of estrogen. The endometrium is now thick, spongy, moist and more vascular to receive the fertilized ovum. During this period stage, endometrial thickness is about 4 to 6 mm. If the ovum is fertilized, there is no breakdown of endometrium and no menstrual flow. This endometrium is now called deciduum. This endometrium is now called deciduum. If the ovum is not fertilized, menstruation occur and new cycle begin. Thank you for watching this video and have a nice day for your examination. Thank you.